Hi everyone, Dr. Chelsea here from Treasure Valley Pelvic Health, and today we are going to talk about lubricants. There are some key things that you should know about the lubricant that you're using in the bedroom that might be the cause for some of the discomfort you're having during intercourse. So keep watching and learn all the tips and tricks about lubricants to help make your sex life just that much more comfortable. If this is your first time joining me, I am a pelvic health expert and energy medicine practitioner. Like I mentioned, today we are going to dive into the details of lubricants. This is a key piece of the puzzle for helping make intercourse that much more comfortable than what it has been for you in the past. Whether it be that you are just resuming intercourse after having had a baby, if this is your first attempt at intercourse, or if you have always struggled with pain during intercourse. Now, there's three main types of lubricants. There's all sorts of little variants out there. But the first type and most common type that I hear people use is a water-based lubricant. So the key thing to know about water-based lubricants is that all water-based lubricants have to have preservatives in them in order to be shelf stable. Doesn't matter if it's an organic type or a non-organic type as far as the other ingredients, but all water-based lubricants will have preservatives in them. So the key thing to think about with that is if they're struggling with dry tissues and you're trying to create a little bit of a decrease in friction, think of it as a sponge. That sponge, if dry, is going to pull that water into the sponge material, leaving behind that preservative residue and actually create more friction. So oftentimes I hear people say that they have to reapply lubricant during intercourse in order to keep it comfortable. So though it sounds great, water-based is not always my top recommendation. The next common one that I hear people use is an oil-based product. So this can range from coconut oil, I've had people use avocado oil, olive oil, any oil of that sort. It will work. It does leave behind obviously a residue as well. The other thing to be very cognizant of, especially if you're trying to prevent a pregnancy, is that it is not compatible with condoms. It will degrade the quality of a condom and break it down, and then it will create a crack, and hence the little swimmers can sneak on by and you may end up with a surprise pregnancy. So be aware of that. Then the third type is going to be a silicone-based product. This is the product type that I tend to recommend for most people who struggle with pain or dryness during intercourse, as it creates a nice barrier, really decreases the friction quite nicely, and many products also have nice moisturizing elements to it, such as vitamin E or aloe. So the other key things to think about in regards to lubricants is if you are applying it, make sure to actually apply it to you and your partner. It's important to allow for a better distribution of the lubrication throughout the vaginal canal so that it will be hitting the areas and covering the areas a little bit more thoroughly that are dry. Trust me, it just makes it a lot more comfortable. Then the other factor, not necessarily related to the lubricants, but more so related to general sexual arousal, specifically for a woman, is that foreplay really is important. Now, we hear this in comedic strips, we hear this in the movies. It's the brunt of so many jokes and storylines. However, it is true that it takes a woman's body, on average, approximately 18 to 25 minutes in order to become fully physiologically aroused. Now, you women might be ready to go and ready to pounce into action. However, it's important to recognize that if you do have a little bit of a dryness factor, you might want to spend a little extra time cuddling and really amping up the foreplay in order to make it that much more comfortable. So take some time. I know 18 to 25 minutes, especially if you have little ones running around, seems like quite a long time. And the closer you are to menopause Or if you are in the early postpartum phase and really just kind of resuming intercourse for the first several times, can really take even a little bit longer. So take your time, have some fun, see if you can find different areas that kind of light your fire per se, and see if you can improve the comfort of your sex life. That being said, pain should never be present during intercourse. Pain is a sign that there is something wrong. I have heard far too many times of women enduring decades, literally decades of pain during intercourse just to try and please their partner, to try and feel like they're connecting with their partner. If you're experiencing pain, I really encourage that you reach out to a pelvic health expert, talk to your provider, your physician, and really try and navigate the why. It's not that you need to just relax. It's not that you need to drink a glass of wine. It's not that you need more practice. It shouldn't hurt. So don't settle for that answer if you're getting that from any of your providers. In fact, I would fire that provider if they told me or had told any of my patients that. They immediately get put down on my non-referral list, let's say. So really be advocates. It should not hurt. It should be comfortable. It should be enjoyable. There will be another video coming up soon that I'm going to dive into more details about how to navigate improving your sex life. We're going to talk in one part about general improving the orgasm and comfort, and then the second is going to be increasing the comfort in regards to people who have pain. So watch for those videos. If you like this information, make sure to subscribe, find a friend, share the video, and make sure that you're spreading the word. And I look forward to hearing from you. Comment below if this resonates with you, and reach out to me if you have any other questions. If you have suggestions for videos you want to hear, I always welcome that too. Have a great one, and we'll catch you next time.